Hi, I'm Dr. Bill Widener with Harbour Medical Centers, and today I want to introduce you to what it looks like and feels like to be a new patient coming into our office with neuropathy. So when you come into our office with a neuropathic condition, first thing you'll do is you'll be in this beautiful waiting area. You'll be presented with some very simple paperwork to fill out, and then once that paperwork is filled out, then we would bring you into one of our initial intake rooms. And here, we'll come in here. In here, we would meet you in a way in which we can learn about your health history. We can learn about what challenges you're having and what some of the primary health concerns that you have. This is the environment where we really listen to what you're going through and what you're suffering with, so that we can really understand what your goals are and where you've come from. And one of the case managers will sit right across the table from you and have that conversation. When you're done in this environment, then we would bring you down the hall. And then as we come down here, we would go into one of our examination rooms. And in the exam room, this is where you'd meet one of our medical providers, and they would be able then to start that neurological and orthopedic exam to start to identify the root causes of your neuropathy. When you're done here, there's a likelihood that there's further diagnostic studies that need to take place. Those would take place in one of our other diagnostic rooms, but then there's a possibility that we may take some x-rays to see more about that relationship between the nervous system and the rest of your body. So in this area here, we would bring you would come into one of our x-ray suites, and then that diagnostic environment would produce those results. And then we'd come over here. Once we can determine the cause of your neuropathy, there's a lot of different environments that we can put you in. This one right here is our decompression area, and we have multiple decompression tables, which allows us to take pressure off the nerve roots that go to the peripheral nervous system, which could be a possible cause of your neuropathy. Down here, we have a number of other technology rooms. This is our laser department. It is also where we have some other equipment that allows for us to stimulate and awaken those nerve endings. Over here, this is our passive therapy room. Again, we have a number of different electrically based therapies that help us to communicate with the nerves, and again, help to awaken them, providing oxygen circulation to those nerve endings. And then in here, we have a number of different treatment rooms that helps with posture and structural integrity. And then in this environment is where actually we have active rehabilitation to help with exercises and with core strengthening. So that's an introduction. We look forward to meeting you in the office so that we can address your neuropathy personally. Thank you.